I want to talk about dizziness. Sometimes people ask, I told the doctor I was dizzy. Why was I sent to an ENT surgeon? And I smile because many people don't realize that organs of the body that controls balance is actually your ears. They do it in conjunction with your eyes and then your joints and the brain, of course. The brain is the master center for it. So what happens is that if there's an imbalance in the impulses coming from the two ears, telling your head or your brain where your head is in space, it can give you dizziness. And the dizziness that is from the ears is peculiar. You know, when the room starts spinning around you, or you feel like you're moving around, and meanwhile, you know, you're just in one position. And that's called vertigo. So when they say you have vertigo, it's a specific kind of dizziness that comes from the ears. And people that are prone to motion sickness tend to have more of vertigo. But the commonest causes of vertigo that make people very, very uncomfortable are two. One of them is infection, and it's usually viral infections, and we call it labyrinthitis. So those are dizziness. Usually people have them after a cold, people have them after a slight fever and all, and then they start having these episodes where the room is spinning around them. The other one has a long name. The acronym is BPPV, and that's called benign, which means it's not harmful. Paroxysmal means it comes, it goes. Positional means it's due to changes in the position of the head, and then vertigo, BPPV. And both of them come with severe spinning of the room or severe spinning of the person. You just feel like you're going to fall. BPPV is peculiar in that the patient says, oh, I just turned over in bed and I had this terrible dizziness. I felt like vomiting. I couldn't get myself until I lay down quietly in bed. And the dizziness lasts for very short periods, maybe less than a minute, a minute. And after that, in between, they're fine until something happens and they change position again. Whereas the labyrinthitis occurs when the patient happens to the patient, and then the dizziness can last a bit longer, minutes, hours, even days, and the patient feels unbalanced in between, but it usually clears after a while. But there are other causes of dizziness, but these are the two most common. Tumors can actually cause dizziness. And in those ones, people even notice that, oh, it's when I move to one particular side. So if you are dizzy and it gives you the feeling of the room spinning around you or your head moving around, not the one that people say, oh, I want to faint, my eyes felt dark, and all those are not caused by the ears. If you have that kind of vertigo, dizziness that you're spinning, you need to see an ENT surgeon.